Welcome back, and hopefully we can answer some of your questions this morning. Joining us again is epidemiologist Dr. Colin Furness. Give us a wave. Good morning.
Good morning.
There he is. Okay, so we're going to get right to the lines now. We've got a busy one here. Naomi joins us from Brantford. Good morning, Naomi.
Good morning, Mel. How are you?
I'm doing well. You have a question for Dr. Furness.
I do. I'm an educational assistant, but I have rheumatoid arthritis, which is considered an autoimmune disease. I wanted to know, is it okay for me to take the vaccine? I'm normally a really healthy person, so I just didn't know if that was okay or not.
So I'm not a physician and I don't want to give clinical advice. So I think the first thing I want to say is talk to your doctor. We don't have a lot of data yet on the appropriateness of vaccine for a lot of comorbidities. So I think it's really important you talk to your physician. It may well be that some vaccines are less or more appropriate than others as more data comes out. So it may be the sort of thing where you want to delay for a bit and see. But I think that's definitely a conversation with your doc.
Okay, thank you so much.
Thank you for the call,
And
Naomi. Have a great day.
Thanks for you and the BT crew being there for us all the time.
Every time. You got it, Naomi. Thank you for joining us every morning. Let's get right back to the lines. And Mary from Toronto. Good morning, Mary.
Hello, good morning.
How are you? You have a question for Dr. Colin Furness.
I do. I'm just wondering, Dr. Furness, if you think it's safe for teachers to go back into the classroom. There's lots of talk about the children, but I'm just wondering in terms of the teachers, when we know, the provincial government has not yet stepped up and spent any money on the schools to make them actually safer. So I'm just wondering what your opinion is on that.
It's a complicated question, and I think ultimately safety is going to depend on where you are. How much COVID is in your community? What does your school look like? What does the ventilation look like? Do windows open? How big are the classes? So I don't think we can say that teachers are in a safe or unsafe position. I think it's really going to depend. I'm concerned because I really want to see testing. And when I say universal testing of kids, I actually mean teachers as well. And I was really hoping that teachers' unions would be pushing harder for that, not because we want to say teachers are a source of problem, but because we want to demonstrate that these are safe workplaces. That's something we haven't done. So I really do want to see testing to be able to answer that question. And I totally understand why you're concerned.
Yeah.
I'm just wondering, maybe you can't answer this question, whether you think any of the medical experts who are advising the provincial government are actually telling them what they need to hear, or whether they're just telling them what they want to hear, so that the government doesn't spend money to actually make the schools safer for the teachers and for the children.
Interesting question, Mary.
There is not a lot of transparency about how decision-making is getting done. We know who's on the science table, and we know a little bit about who's on the health table, but ultimately those decisions are being made behind closed doors, and we do have some evidence sometimes that they've ignored scientific advice in making those decisions. Not always, but they have. So it's very hard to know, and I understand why you're skeptical or suspicious. It's just not clear why we wouldn't have collected the data we need to collect in the fall to really understand school safety. We could have done that in the fall. We didn't. That was a decision that got made, and I think that was a poor one. So I'm cautiously optimistic that some schools in some places will be safe. However, just to open them up and assume they're safe, I think is a mistake.
Yeah, Mary, thank you for that call. And I think she brings up a really great question here is the disclosure of information, right? And that's something that has been lacking. And from a media standpoint is being able to get that information to share with our viewership as well. Paul joins us from Peel Region, and it's a question about immunity. Good morning to you, Paul.
Good morning. How are you?
I'm doing all right. Your question today.
Mike, it's a three-part question. I recently recovered from having COVID, had no idea, and public health couldn't even trace how or where I got it from. And I keep hearing from people, well, don't worry, you're immune. And I say, well, am I? What degree of immunity do I have? And luckily for me, my case was mild recovery. And does that affect the degree of immunity that you get?
So when people have a serious bout of COVID, their bodies really react and they produce a lot of antibodies, and so you get immunity. For people who've had a very, very mild case, it's not clear that your body will have produced those antibodies. You may have cleared it just with your T cells. You may have had a very, very minor brush. It sounds like maybe you did. You can get a serology test, a blood test. Ontario's not paying for that. So that would cost you, I think, maybe something like $200. That would tell you if you have antibodies. So that would answer that question. I think we should be offering that testing for free, because I think it would put a lot of people's minds at rest in terms of, do they need to get in the queue for a vaccine? Do they need to get in the queue for a vaccine now? So that would be the way to answer that question. And apart from that, I think it's likely perhaps you don't have immunity. I wouldn't assume that you do.
Do you have a follow-up question?
I don't assume that I do, so thank you for that.
Paul, so I'm glad it was just mild symptoms here, and I'm glad you're doing okay. You have a follow-up question, though, to this.
It was really just based along with all the immunity as to whether or not how long you would be immune if you had immunity.
Okay.
That's a tough one, because it's first of all, we don't know what the long range looks like, because we've only had COVID around for 10 months. So we're a bit blind about that. The other thing, of course, is the virus mutates, as all viruses do. This is a slow mutating virus. That's the piece of good news in all of this. But it may mean that the various contagious variants that are now making their way around the globe may mean that people can get reinfected. And it may mean that once we've had our vaccination, we may need another shot in 6 months or a year. So it's a long game to try and figure out what that looks like. And we just don't have all the answers yet.
Thank you so much for your call, Paul. Hopefully we were able to answer your questions here.
Yeah, you absolutely did. Thank you so much.
Thank you. Take care. I want to get to one email, Dr. Furness, and this is from Douglas and Aurelia saying, I am in my mid-50s. I'm curious when I can expect to get my vaccine. Will I have a choice in which of the vaccines I can get?
Well, there's a calculator that you can get online. I can't remember who produced it, but it looks at the expected supply in the population and the queuing, and you put in your information. If you're a healthcare worker, you move up in the queue, and so on and so forth. If you're just a regular person who's in their 50s, I've used the calculator to suggest that it'll be sometime between late July and September. So it's not very precise, but sometime later in the summer. That would be it. In terms of choice of vaccine, we don't yet know. I mean, it really depends on when things are approved, and if some can be done in physicians' offices or pharmacies, like the Johnson & Johnson vaccine, for example, just requires regular refrigeration. If we have a proliferation of those, yeah, you'll probably get a choice. In the shorter run, probably not. So it really kind of depends on when and how those vaccines get approved.
Yeah, and that calculator, Dr. Furness, I believe it was a University of Guelph researcher, because we did the calculator on air too, but we did it about a month ago. So whether or not there's a backlog in the supply, that might change the results. But I think we'll put up a link to the one that we're talking about. So thank you so much for your time. I'm glad we were able to answer a lot of these questions for our viewers as well. Appreciate it, and we'll check in with you again. Thank you.
My pleasure. Thanks.
Take care of yourself. All right, 6:52 is your time right now. Coming up here on Breakfast Television, what's going on? What's going on?
What's up?
What are you doing, Dee?
Oh, I just finished making a stir fry during that segment. It was great. I like cooking during important things.
This guy's
Yeah, I
making
just
a
want to put the
stir-fry.
leftovers away in the fridge.
Where's your Tupperware?
No, just put the pan in. It's okay.
Are you kidding me? Is that okay?
Yeah, it's fine. Don't worry about it.